Last year, around this time, we saw a spike in COVID cases. Experts then were warning of a very bad flu season amidst the COVID-19 cases. Well, now experts, they're sending out warnings of a twindemic, saying this year you might see some of the same things you saw last year. For more on this, we have cardiologist and medical specialist Dr. Fahmi Farah. Doctor, how are you?
I'm doing well, thank you.
Thanks for joining us. What do you know about this twindemic that experts are renewing warnings of?
Twindemic is, as you said, when we can get both the COVID virus infection as well as the flu. And last year we didn't see as high numbers for flu as we do usually, simply because of the precautions we were all taking. People were wearing masks, social distancing, washing hands. That played a big role in reducing the number of flu cases we saw last year. However, the concern this year is that the flu numbers may be a little bit higher just because many places are no longer requiring masks. People are just not wearing masks the way they did last year. So social distancing is not happening as well as it did last year. So that just increases the risk of exposure and higher numbers for the flu. Twindemic, as you know, probably our hospitals are very full right now with COVID cases. And if we start to have more cases because of flu, it could be a kind of a crisis in terms of bed space availability and having the resources available to help people.
And speaking of the resources being available, this just came in to the studio. Here in Stark County, where we're located, the Stark County Health Department, they issued a statement saying that the department is currently experiencing a large volume of COVID-19 cases, and it's making it difficult for their staff to contact every case or close contact in a timely manner. I just got this 4 minutes ago, right before we went on. And the resources, they are running thin. And that's why I believe, and you can correct me if I'm wrong here, doctor, but you are seeing so many states opening up for outside doctors, nurses, STNAs to come in because they don't even have the resources. Is that right?
That is correct. Yeah, we have a lot of traveling nurses who are needing to help us out because we're just so overwhelmed right now in our hospitals.
Yeah, my mom's a traveling nurse. She just texted me yesterday. She was back in Ohio for maybe a week. She just got back from Texas. Now she's flying to California in a few days. And I know that Texas, when she was there for her stint, there was an order saying, if you're coming here, if all of the nurses that we're requesting have to be out-of-state nurses. And it made me wonder, why doesn't the governor want any in-state nurses? That's a whole other conversation there. But do you think people should be getting the COVID booster when they're eligible and when it is fully approved?
I do, yes. So at this time, we're being told that the immunity from the vaccine, both the Pfizer and the Moderna, is roughly about 8 months after you've received both the vaccines. So we know that it's not a very long-term immunity, and for that reason, I believe that booster is going to be important and helpful in continuing to prevent the spread as well as just reducing the numbers in general.
But people, they're still hand washing. Some are even wearing a mask, and there's the big debate. Well, if you have the vaccine, you're protected. If I don't want to get it, that's my choice. Why should those people be worried about it? The ones who are not vaccinated, should they be worried, or should they just go about their day?
Oh, they should be worried. To give you an example, the numbers, our hospitals are very full, and 97% of those cases who are very sick in the hospital right now are those who are not vaccinated. And it's not just, the Delta variant, it's not sparing the young ones like we thought with the previous strains. A lot of young folks are in the hospital, and we're seeing death in all age groups from those who are not vaccinated. So clearly, the people who are not vaccinated with COVID are at higher risk of getting sicker and needing hospitalization and critical care if they're getting infected with COVID.
Yeah, there's a lot to it. Whether you believe that you should be vaccinated or not, if you're not, wear the mask, try to keep other people safe. I want to say 17 of the 19 schools here in our county that we're in yesterday, a majority of them have issued mask mandates. After starting the year 2-3 weeks in without masks, now they're saying, okay, we're seeing a rise in cases. You guys have to wear masks. And the governor, he just issued a thing earlier this week to local superintendents. And he told them, even if the kids are wearing a mask or if they're vaccinated in school and they come in contact with someone in school, they don't have to quarantine. What do you think about that? Say you do have a mask on, you're unvaccinated, but you come in contact with someone who tested positive for COVID. Should they quarantine?
I believe they should, because we know that this Delta variant is so contagious that unless they're wearing N95 masks, they can still, if they're in close contact, they can still get the virus. So I do believe there's some utility in quarantining for a few days to make sure that they're not infected.
Yeah, it's a lot. It's a lot. Are you, where are you based out of, Doctor?
I'm based out of Dallas, Texas.
Okay, so you're in Texas, so you're obviously seeing some of the spikes in the cases that they have there, and I know that is almost like a hotbed with these new cases recently.
Yes, we're seeing lots of new cases, and really our hospitals are pretty full right now. So that's why it's a great concern with the flu season coming. If we see increase in the flu cases, that could really get us into trouble in terms of resources. Also, I want to point out to our listeners that it is possible to get both virus at the same time. So there could be some patients who have the flu and the COVID at the same time, and that would not be a good situation.
Oh yeah, it really wouldn't be. Now, what about the people who they're on edge about getting the virus or about getting the vaccine? I mean, they're on the fence. They don't know if they should get the vaccine or not. And I'm wondering, do you as a doctor, as a practicing doctor, do you tell them the pros and cons and then let them make up their decision? Or do you really strongly recommend that your patients get the vaccine?
It's a little bit of both. You know, at the end of the day, patients have the autonomy to make their own decision. I try to inform them with facts, because there are a lot of non-factual, basically myths going on, misinformation about the vaccine. So I try to educate my patients with the information that's based out of facts and science so that they understand the pros and cons, and the pros definitely outweigh the cons. And then it's up to them if they want to take the vaccine or not. But I do highly recommend that they do for those who are eligible.
Yeah, for sure. Well, Doctor, I appreciate you taking the time. Dr. Fahmi Farah, cardiologist and medical specialist, thanks for joining us this morning and explaining some of these, I guess, the warnings that people should be concerned about as we enter the flu season.
Oh, thank you so much for having me.
All right, thank you.